Good evening. Dr. Vivek Murthy is a physician and former Vice Admiral in the Public Health Service Commission Corps. He served as the 19th Surgeon General of the United States. Dr. Murthy was the first Surgeon General of Indian descent and the youngest active duty flag officer in the Federal Uniformed Service. Dr. Murthy, welcome and thank you for being with us virtually this evening.
Thank you so much. I'm glad to be here.
Dr. Murthy, we're here this evening at the 2017 Hero Forum where we're celebrating winners of the annual Koop Award. These are honorable mention winners, PepsiCo, IDEX Laboratories, and Delta Airlines. It's named after Dr. Koop, who was with us at the founding of the Health Project over 20 years ago. Do you have any memories of Dr. Koop? Did you ever get a chance to interact with him?
Well, I have plenty of memories of Dr. Koop, although I unfortunately never had the privilege of meeting him in person. He passed away just about a year before I began my service, and one of my great regrets is that I did not have the chance to work with him. But I certainly remember him over the years. I remember the stands that he took on tobacco, the incredible work he did on HIV. And in fact, when I became Surgeon General, I thought back to his work and looked to it, in fact, for inspiration. The letter that I issued to every healthcare provider in America, urging them to join our efforts to take on the opioid epidemic in America, that letter was in fact inspired by some of the work that Dr. Koop did. So his legacy, I know, lives on in the hearts and minds of many people in our country, and I'm certainly one of them.
Yeah, in many ways, Dr. Koop was iconoclastic. He went against the grain sometimes for things that he believed in. And was that the philosophy that you brought with you to the Office of the Surgeon General?
Well, one of the things that I believe is so important about the Office of the Surgeon General is that it is rooted in science. It is an office that is not political. Its allegiance is to the truth, to the science, and to the health of the American people. And that needs to be true regardless of whether Surgeon General's administration agrees with him or her or not. Dr. Koop was very brave and thoughtful in his fidelity to those values, those core values of the office.
The people who are attending this conference are firm believers in public health and workplace health promotion. What's your opinion of the role businesses can play to improve the health and well-being of Americans?
Well, there could be no more important task than improving the health and well-being of Americans, because as all of us know, health touches everything we do, whether we want to be productive at work, make contributions to our community, be there for our family, or contribute in any other way to society as a volunteer. That requires, that really depends on our health, both our physical health and our emotional health. When I traveled the country as Surgeon General, one of the things I heard most clearly from communities everywhere, whether it was rural areas in Alaska or urban centers on the East Coast, is I heard that people wanted us to focus more on preventing illness. They know that the rates of obesity are high, that more and more people they know are being diagnosed with diabetes and heart disease and cancer. And their question is, why is this happening and how can we prevent it? The truth is, if we're honest with ourselves, we recognize that as a country we've done a poor job at prevention. We've invested the lion's share of our resources in treatment. And for that reason, we have some of the greatest treatment centers and therapeutics in the world. But we don't do as good a job on prevention. The question is how to change that. And this is where I think business comes in, because people spend a third of their lives or more sometimes in the workplace. And the workplace is not just powerful in terms of shaping people's day-to-day experience, but businesses, and whether they're small or large, are often important players in a community. They can be pillars in a community. They can help shape culture in a community. And the truth is, if we want to shift toward more of a focus on prevention, that is as much about culture as it is about policy and programs. And that's where I believe that businesses have to be an important part of shaping that culture, pushing for a focus on prevention, and leading by example by creating work environments that ultimately invest in prevention and help people lead healthier lives.
So when a very skeptical chief financial officer meets you and says, well, I'm already paying so much money for health insurance, why should I be paying more for prevention and health promotion? What's your response to that?
Well, you can look at this either both from a common sense view and from a data point of view. From a data perspective, we know enough now to know that when employees are both physically and emotionally well, that they contribute more in the workplace, so they contribute to productivity gains, and they also have lower health expenditures. So if you solely care about the healthcare expenditures of your company, then you should care about employee wellness, because there's data to support that. However, if you think about it just from a common sense and practical experience point of view, all of us have had the experience of being ill or being in pain, for example, and recognizing how that distracts from our ability to be fully present at work and to be as productive, as focused as we want to be. We've all also been in situations where we have been stressed, either because of something happening at work or at home. And we know that stress can have adverse effects both in the short term on our performance at work and also in the long term, like on our health. And so it makes sense, both practically and in terms of the data, that if you want to improve how your business is doing, that you have to focus on the health and the well-being of your employees.
You mentioned the word culture, and I think that's important, and we are very focused on culture and culture of health. Expand on that. What does it mean to have a culture of health in the workplace?
Culture are ultimately the implicit beliefs and attitudes that a group of people have. And when I was, years ago, when I was beginning my technology company called Tron Networks, I went to several other entrepreneurs for advice, and we were building a company that was ultimately seeking to accelerate research and innovation in clinical trials. And I remember one entrepreneur said to me, he said, as you're building your company, remember that culture eats policy for lunch every day. And what he meant by that was you could have the best employee handbook, you can have the best guidelines and policies, but ultimately if you have the wrong culture, your company is not going to do well, because people ultimately make their decisions about what they do and don't do, largely guided by the culture in the company. And those could sometimes be unsaid norms. And this is why in shaping culture, the involvement and engagement of leadership becomes really important. If we want to create a culture that supports healthy behaviors, whether that's physical activity, good nutrition practices, stress management techniques, or healthy social connection in the workplace, that impetus, those examples need to come from leadership. It needs to be both a top-down and bottom-up approach. And so culture is really powerful, but culture is ultimately shaped by the people who are part of an institution.
Now that you've left government, I'm curious, first of all, to know what you're doing, but secondly, to know what you think government's role is in improving health and well-being of workers.
I think the government has a very important role to play when it comes to advancing wellness, particularly in the workplace. Government can invest in research to help us understand what programs are working and what are not. We know that ideas are great, but we have to study these ideas and understand what is data-driven before we scale things up and implement programs more broadly. The second thing government can do is it can convene people, it can bring people together to share best practices, to share what's working and what's not working, to help companies that are contemplating wellness programs actually implement them and scale up. And the third thing government can do is when it finds programs that ultimately do work and work well, it can explore the use of laws and regulations to ensure that these programs are more widely adopted. So these are powerful roles, but what's important is that government can't do everything. Government can often not innovate at the speed that the private sector can. Sometimes it can go quite fast, but what is really powerful about the role of businesses and employers is that they have an ability to innovate in terms of wellness programs at a speed that government often doesn't have. And that's one of many reasons why we need business to be highly engaged in not just waiting to see what government has to say about wellness programs, but actively experimenting and pushing out on their own.
What would you like to tell the C. Everett Koop awardees this evening in terms of where you're coming from as Surgeon General, kind of the main doctor in the United States, having served in that role? What kind of message would you like to convey to them?
First, I just want to thank all of the folks who have come to the event today and who have been engaged, who have submitted proposals, congratulate those who have been awarded honorable mentions. But particularly, I want to thank everyone for their interest in this area. The workplace is one of the defining places where people spend their lives. Your experience at work shapes the lives of so many people and affects their health in profound ways. And the only way we're truly going to improve the health of Americans is if all sectors are involved. And the employer sector is especially an important one. And at a time where people are hungry for solutions, where they want better health, we need employers and businesses to step up and lead the way, to not wait for government or for somebody else to fill that gap, but to recognize that many businesses already have stepped up and have showed extraordinary results. And we now need more and more businesses to actually follow in their stead. Ultimately, the question that we have to ask ourselves is, what kind of country do we want to create? Do we want to create a country that is languishing in poor health with declining productivity, where our children are dealing with higher and higher degrees of stress, and that's impacting their life course? Or do we want to create a nation where we invest in prevention from the beginning, where every sector doesn't say, hey, that's not my job, but recognizes that we need to be involved in creating a healthier population? If we do that, if we create that culture of health that flows through not just the healthcare sector, but through businesses, through nonprofit organizations, through government, then we can ultimately create a healthy and strong America, which is what we all deserve.
Dr. Murthy, thank you so much. Thank you for your service to this country. Thank you so much for being here with us tonight and honoring Dr. Koop and his legacy. Appreciate it.
Well, thank you so much for having me, and thank you for all your work.